Hey, Liz, I went ahead and added your email to the end of the announcement, so it'll be there for everybody.
Great.
We'll go ahead and close out my email and everything before we get started here.
Hey, Pat,
Yes, ma'am.
when you're done, we need to talk about that PSH thing. I keep forgetting to call you.
Okay, yes, ma'am. Okay, it's just now 1 o'clock. We'll give folks one more minute and we'll get going. I know there's an active threat class going on right now too, so I think we will have some people who won't be here because of that.
What's SWGAHL? I'm just looking in the chat box. Devlin?
Southwest Georgia Housing Opportunities.
Okay.
Okay, it's 3:01. We'll get started. Folks will be joining us, I'm sure, as we get going. But let's get a rolling here. Got some interesting stuff to talk about. From the beginning. All right, let's see if it will let me go ahead and start sharing my screen here. All right, can everybody see my PowerPoint?
Yes, we can.
Cool. All right.
But you may have to put it on slideshow.
Wasn't letting it happen. That's why.
Oh, okay.
Yeah. Hey. Come on.
She was having problems with actually getting the link to Zoom,
Mhm.
and we actually cannot log in. It's
Why?
saying that you're in another meeting.
Okay, apparently we're having some technical difficulties, so give us 1 second. Hang on. All right, I think crisis averted. Let's go over really quickly the April.
I only got some
Numbers.
volume.
I'm sorry? You having trouble hearing?
Yeah, I finally got some volume.
Okay. Okay.
About that summer home.
Okay. Um, Going over the April referrals, April was actually a light month when it came to coordinated entry, sort of probably chalking it up to the fact that folks got their tax returns. So it was a light month, about half of what we normally see. And then you'll see the breakdown. Again, still the majority of them the referrals going to rapid rehousing. Emergency housing vouchers are starting to wind down. There's probably less than 15 across both of the public housing authorities that are available. Some of them were thought to have been used, but the clients let their voucher run out without them securing housing, so they got turned back into the pot. So we had a few more than we thought we were going to have. Going on to the rapid rehousing and how those were broken down. ESGCV is winding down. That has an end date of September 30. I'm sorry, yes, September 30. So those referrals will start being put on. They will stop having referrals to those programs very soon because it's not going to do justice to the client unless they're able to sustain pretty quickly on their own without any ongoing assistance. And there were 6 referrals to the Salvation Army's family shelter. Any questions about referrals before we move on to the meat of what we want to talk about today?
Hey, Pat, I do.
ma'am.
One thing is I know with the MTW vouchers that Housing Authority has,
Mhm.
that number may be little off. It may be less than that because I know that they are coming across a few that was just put under the wrong program code. So they're in the middle of correcting those now. I was informed after submitting that to you. So we may have less vouchers.
Okay, well, if
available.
that'd be great if we could get a confirmation as soon as possible, please.
Yes, ma'am.
That'd be great. Thank you.
You're welcome.
All right, I mentioned the emergency ESGCV is expiring. Of course, we all know that we're in the middle of regular ESG season and it's application time. And of course, they're due in 2 days. If you have not received your email with your certificate of consistency or local government approval, holler at me like now. I will resend them. I sent all of them to everybody on April the 24th. I do have the original signatures here if you just want to pick up the original, but of course you have to scan it and send it to DCA electronically anyway. So, to me, it doesn't make a huge difference, but they are here. They were sent on the 24th. Did everybody get them? Somebody give me a yes, no, something. Or not? I'm going to assume then that everybody got them, if no one's saying anything different.
I see a few nodding heads, Miss Pat.
I'm sorry, huh?
I said I see a few people that are nodding their heads.
Okay, got you. Well, Tiffany, we're gonna be talking about you in a few minutes, so you're good.
Uh-oh.
Uh-oh, yeah. Talking about performance that we had talked about you helping us look at from a monitoring standpoint. So,
Okay, yes, ma'am.
all right. So hopefully everybody's good to go. Again, they're due. Remember, guys, the applications are due at noon on Friday. We're very used to sometimes those 5 o'clock or actually 8 p.m. Eastern time submissions if it's a federal grant. Just remembering it is due at noon on Friday. Don't let all your hard work go for nothing for not sending it in on time. So that being said, I'm going to move on to talking about last month. We mentioned that, our continuum of care did receive full funding for our annual continuum of care application or competition last year. We received, as you can see here, just over $1.8 million in project funding to include a bonus project for, for HMIS. Very exciting. However, we squeaked by literally by the skin of our teeth, not unlike many others, but we had some things that we need to improve upon. Just last week, we had the debrief from HUD on what the application scores were for everybody, what it looked like, and talking about how each community has the opportunity to of course improve. No one got a perfect score. You can see here the highest score for any continuum was 188 out of a possible 200, and the lowest score was a 53. Median, they're 154. We scored at 150, and the weighted median was 162. It's always been the goal to be at median, and better yet, even at weighted median. So we have some work to do. And here you can see the sections of the applications and what where we fell short. The things that jump right out at me are right here, that 2C, that system performance, and the coordination with housing and healthcare. We missed 13 points there. If we had 13, we'd be at 163. We would have been ahead of the weighted median if we had just gotten everything for system performance. So that being said, thought, why don't we look at system performance and look at it from, we're going to look at here just together. Again, the board will start examining it and pulling it apart next week. And the efforts will be led, like I mentioned, Tiffany, our good friend from Synovus, who serves on our COC board. We talked about it at the last board meeting. She'll be heading up performance and outcomes to start doing a deep dive into performance of the system, and then looking at each of the projects and how they contribute to that system performance. There are some key things for system performance to talk about as well, that you may be helping your program or your organizational performance, but when the scorings are done, and when the numbers are pulled annually for the competition, they are pulled based on a system. So we'll go over a few of those things. Any questions so far?
Hey, Pat,
Yeah,
I've got a request for you to make the slides larger by going to show, and there's someone needing into the room. Please and thank you.
yeah, I don't know if this is making it better. Wasn't letting me go into, let me try this. Let me see. Is this any better?
No,
Kathy?
it's still small.
Okay, let me try something else. Let me unplug this other one. Let me see what happens here. Let me stop the sharing for 1 minute. Let's try it again. Make sure, please, if everyone hasn't, put your name and organization in the chat box, please. We're going to try this one more time. How was this?
That's
Better.
good.
That's better.
Okay, cool. All right, we're moving along there. Okay, cool. And it looks like it's giving me subtitles too. Cool deal.
Pat.
Yes.
D'Amica said she's trying to get in. Can you let her in? The room?
There wasn't a passcode. Let me see what I can do.
Okay.
There's nobody in the waiting room here because we don't have a waiting room.
Okay.
Sorry.
Okay.
All right, so if we look at this going to the next section, or the places that I pulled out here of the debrief for system performance. Length of time homeless, we missed 8 points there. And then here, exits to permanent housing or retention of permanent housing. We're gonna do some deep, or actually a little bit deeper than surface looks today, but be ready to have large conversations across the continuum about what those look like going forward. So length of time homeless, and that's one of the things I wanted to bring up, that when we're looking at this, this is not the length of time they were enrolled in your program before, I say that, the client was enrolled in your program before they exited to housing. This is the length of time they are in the system. So from the moment that client hits the system in coordinated entry, that is when the clock starts ticking. So many of us thought, well, if you know, I enroll the client and they're housed within 30 days, my numbers look really great. Well, that's fine. But if it took you 30 days to contact the client, that clock had started ticking 30 days before you contacted. So just bearing in mind that this is a system look at. So that being said, as soon as referrals come and all, making sure that those contacts are made so that that client can start that process. And just a caveat, remembering that in programs, if you're working with a client, that client should be enrolled in your program. There are going to come times where your client cannot provide the documentation needed to prove eligibility, or you find the client's not eligible. Then the client would have to be discharged or exited, and that needs could not be met by program. But if you're working with the client, you need to have enrolled that client in your program. So length of time homeless, and we're going to do a little bit deeper look is what the COC guidance in the application was on what this said. And then again, exits to permanent housing and retention. These two will be looked at from a program standpoint and then from a system standpoint to try and find out where we have the bottlenecks. And I know we're in a point in our society, in our times, where it's taking at least 3 times longer to help folks find housing than it was anywhere else. That's not very different than everybody else, but perhaps it's as easy as we need to have a better plan on how we address that. We need to have some targeted recruitment, some targeted retention strategies for landlords, for providers. Again, just throwing things out there, but we're going to have to do something to improve those points there. The exits to permanent housing and or retention of permanent housing. Again, when we're bringing people into or people are entering our system, are we helping them to exit to permanent housing situations? And those that do, are we setting people up to sustain or retain that permanent housing? Or are we just providing rental assistance or a stipend or whatever we want to call it for a short period of time? And as soon as that's over, then the client is once again back in the point of facing homelessness, or back entering the homeless service realm. So those are the kinds of things. And again, it's looking at it from a system perspective. Are we giving the clients all of the tools they need to retain those housing outcomes? Let's see here. Okay, so here we go. Length of time homeless. And again, this is coming from HDX, which is the HUD reporting reporting site. We do what's called a competition report, and it comes off of that. And I'm going to show you a shot of ours. So it talks about it's based on the numbers and then our response on what our plan is to combat that. So that being said, this came from the HDX competition report. And remembering, they look back the year before. So we did this application in 22. They would be looking at 21's numbers. So in the average length of time is what is looked at, not the median, but the average length of time homeless. We saw a increase in this from 89 to 103. So there it is right there. Sorry. So we saw a difference of 14. So an increase of 14 days in whether it be someone in emergency shelter or someone in emergency shelter or transitional exiting to permanent housing. that's, that's an extra 2 weeks. Doesn't seem like a lot, but if it's 2 weeks times how many people, then we start looking at what that compounded number might look like. So thinking about how we could, going forward, shorten that length of time. So looking at it from the standpoint of those who were in emergency shelter or permanent housing, we saw an average length of time homeless. There was a difference of 142 days. So once someone entered our shelters, it took them 14 days longer, but on average, a person was remaining homeless 332 days before they got into housing. So that's doggone near a year. We've got to figure out how we affect some change and how we go about it in a systematic way. All of us working together to do that. And that's what I mentioned earlier, that Tiffany from the board will be leading a group to start drilling down on these numbers from a system perspective, and then each one of the programs in our continuum. We have an opportunity to take it in a different direction. We have an opportunity to grow, and we have an opportunity to better serve our clients. So moving on to the next. And excuse me, and this is about retention, and this is, again, came from the same from the guidance for the competition last year. And the numbers came from, again, the same HDX competition report. And it was a combination of the report and the strategy in which we used to change the retention rate for those who have exited to housing to help them keep it. So looking at this, overall, we've had returns in the past 2 years of 8%. And that's a nice little hefty increase. We look at returns here of 13 to 24 months. We're here at 2%. We're at 3% in less than 6 months. So again, how do we affect just a couple percentage points here, a couple percentage points here? Because it looks like on the short term, we're doing okay. We're doing okay on the short term. If you're looking at emergency shelter, probably not so much, but overall, as a system, we're looking okay in the short term. What are we doing, or what are we not doing to have the clients have the long-term success, so that 13 to 24 months and over, that they retain their housing? So what are we doing? What's not working? What do we need to change? What do we need to enhance to make sure that folks retain their housing? And again, they may not have come back to you, but they came back to the system. So once they come back to the system, there we go again. It triggers that matrix or that metric, I should say, of that person or household returned to homelessness.
Can I ask a question, ma'am?
Sure, please do.
I apologize. This is Melvin Morgan.
Well, hey there, Melvin.
How you doing, ma'am?
All right.
You asked a question about the return to homelessness. I think one of the things we need to look at is what type of case management and the length of time that case management for that homeless individual is taking place.
Mm-hmm. Keep
Because-
talking, Melvin. I'm listening.
Because the numbers that you just, the timeline, are they still receiving case management, or have they been closed out?
To be honest, I can't tell you exactly by looking at these numbers. Now I can drill down and exactly who these people were. That's not a problem. We can do that. But to my best guess, and somebody tell me my guess is wrong, I don't know a project right now that funds case management for more than a year.
Right. So in saying that, what type of community resources can we link them to that would possibly assist them to continue to sustain?
Right. So therein lies, how do we then, as you said, have a community resource, a community, for lack of better term, community case management program that would pick up after the housing connected case management was no longer feasible? Is that sort of what you're thinking?
Yes, that's what I'm asking.
Right.
Does anyone know of any? Because that may be a gap right there.
I can tell you that in the last funding we did for a funding application we did for the special NOFA that came out last year, that was one of the things we put in there. And no one in Georgia but Balance of State got funded for that NOFA. So I don't know of one. If someone has one, they're hiding it. That's for sure.
Because when you look at prevention, they can only, it's a cap on prevention, how many times you can come back and get those services to help you sustain housing.
Sure.
And then the next question is, once they're put into housing, are they put into affordable housing?
Sure. Well, Melvin, I think you just volunteered yourself to serve.
I was just asking. I was just asking. I didn't want you to talk alone.
Those are absolutely valid points. Excuse me, I'm gonna close my door. 1 second. Okay.
Well, since Melvin chimed in on that, can I piggyback
Oh,
off of him?
Lord. Hey, Kim,
Hey.
I'm gonna stop sharing so we can look at each other for a minute and then we'll get back to it. Go ahead.
What I was gonna piggyback off of Melvin, which I do agree wholeheartedly with him, we do need more case management services. But until we get the funding for that, we just have to work with what we have. And I just believe that just from experience that when we do have the clients in our possessions in our program, I really do feel like we have to get to the root of the issue of the clients when we have them, and not just literally house the clients, because they come, we got a housing referral. Okay, I'm just gonna house them and move them on. We really have to get to the root of the problem, because sometimes housing is not the issue. We
It's
just
a
have
symptom.
to figure out,
It's a symptom.
Yeah, it's a symptom. And and what happens is, it's just like a tree. If you keep cutting the branches and you don't cut the root, it's just gonna keep growing back. So that's why they keep returning back to the same situation again, because we're not getting to the root of the issue. So if the root of the issue could be, I'll give you a prime example. I had one client that she had been going through the programs for so long. And what the situation was, it was really family reunification. There was an issue between her and her mom for years. They hadn't spoken, and they had been in the same town. They're from here in Columbus, and they didn't have a relationship. So basically, she just really needed someone to just help her figure out how to mend the gap between her and her mother. And her being able to do that, she was able to, really connect with get some resources and working on her as an individual. So she was able to be connected to New Horizons to, to check up on, her mental health, her depression. She was able to get some counseling, as well as get some spiritual counseling here with Salvation Army. And then we were able to get her into the hotel motel program. She was sent to Open Door, where she was on the rapid rehousing program at the time. She's now housed, but in the process of that, she was reconnected with her mother. They're working on their relationship, but just the fact that they were reconnected and they're speaking, it's dealing with the root cause of the problem. Now she is able to get that burden off of her, where she's able to strive and thrive a little bit more on a job. She's able to, to sustain on a job. Her head is clearer, where she can think better. Now she's able to You know what I'm saying? She's able to do more now without having that burden of, I don't have that family support, rather than coming to the programs to have that support. So I think a lot of times we as case managers just can't look at the surface of an issue when it comes to the clients. We have to sit down and take the time out, especially when it comes to that intake appointment. Stop looking at time and looking at people as a number or as an intake and just say, okay, let me hurry up and do this and get them in here and get them out of here. Take time, get to know your client, get to the root of the problem. Sometimes you might not get to the root of it right then, but learn to build a relationship with a client and listen, really listen to them and see what's going on with them. Because like I said, housing, like you said, might just be the symptom. Homelessness might just be the symptom. And sometimes they need the wraparound services because we might not be just the only service they need. And we know that we're limited on case management. So they may need all of these services to help. All of these hands need to touch them in order to get them to where they need to be and to stay connected to them so they won't be able to return back into the community. Because that way, if I lose touch with them, you're probably staying in touch with them. And next thing you know, Family Connection staying in touch with them. And somehow somebody is still engaging with them some way or somehow. So I just feel like, you know, since there's a shortage with the case management, we as case managers now gotta do what we can do at full capacity to work with clients.
And Kim, I the fact that you said, you know, that you or I may not be everything that client needs, I think that's huge for us as case managers, as service providers, to realize that we can't be everything to everybody. And it's not fair to the client for us to try to be, because trust me, you don't want me to do certain things for you, because that's not my forte. We can give you housing, but you don't want me to do those other things. So to be able to be able to work together and collaborate and coordinate, you're right, with other community resources is huge in meeting the needs of the client. Thank you, Kim. Somebody put something in there. Okay, Liz put a link in here to the social worlds of people with lived experience. So we'll make sure it's on the chat for everybody, but we'll also include it when we send out everything from our website for today's meeting. So we'll be glad to include that. In fact, I'm gonna try and see if I can.
Pat, I have a question.
Sure, go ahead, Miss Terry.
When they get into the system, do we have, I thought you had a comprehensive assessment form that they do, so you'd know exactly what all the issues are before they even before they're sent to a provider. Do you have that?
There is an assessment, but I think to bring back to the point that Kim made, you're probably not at initial intake, whether it's certainly not at coordinated entry when you have a complete stranger who's asking you all of these quote unquote personal questions. You're probably not going to get a whole lot. You darn sure aren't going to get to the depth of it. So when you're having that first meeting with that case manager, you know, going over those things, making sure that everything is, hey, I just want to make sure, not just assume, oh, yep, same as last intake, going over and asking the questions again, explaining that you're not asking the questions to interrogate someone, you're not asking them to get into the business, but it's about making sure that everybody gets the resources. And the more you talk to someone, it's like, yeah, well, I should have told you, but, you know,
Yeah,
no, I don't have any bills, but I'm going to be picked up for not paying child support. So I'm probably going to be in some trouble or whatever, kinds of things. So that will, again, I think goes back to building that relationship.
Yeah.
So let me go back here really quickly. I'm not going to belabor the slides too much, but I do want to, let me hit.
Hey, Pat.
Uh-huh.
There's also a question in the chat asking, have we addressed the transgender community needs?
I don't know what that question means. Have we addressed the transgender community needs? We have to meet everybody where they are.
Okay,
And avail them of resources. Was that the question?
this is Jennifer. I asked that question.
Hey, what's going on?
Just
just know, I guess, I think the thing is there is a transgender person that does not have a place to stay.
Mhm.
And, you know, I guess the thing is you can't house them with men and you can't house them with women. Does that make sense?
Yes and no. We can't refuse to house someone based on their identity.
Okay,
So that we
okay.
have to come up with an alternative if it's not going to work for them.
Okay.
Then we have to come up with an alternative.
Okay, great. That's what I needed to know.
Yes,
Great.
ma'am.
All right,
Yes, ma'am.
thank you.
So hopefully someone will nod and let me know you can see my screen. The next, I'm trying to go back, sorry. Okay, so I said that we were talking about, again, returns to homelessness or retention of housing being a huge issue. Now, this one is one that I'm going to throw out here for consideration today and would welcome anybody's looking through the guidance, looking through what was put out last year about leveraging relationships with healthcare providers and housing providers. We did not get any points on this because it was really clear, and I'm going to show you a little bit here. It's talking about housing subsidies, and it's talking about partnering with other agencies. But new PSH proposed projects or RRH and transitional to RRH. So they're wanting new projects where at least 25% of the units are being funded by another funding source and are connected with healthcare in some way. We have a great relationship with our healthcare providers across the city, across the community, but did not sort of fit in this little box. So I say that to say also, if anybody here is thinking about the fact that, you know, I'm seeing that we have a greater need for this, that, or the other, or our organization needs to grow our rapid rehousing program and possibly, you know, have a transitional program that we need to transition into it or change our model to a transitional to rapid rehousing program. There are funds out there. These are bonus projects that are available. It could be done through reallocation. So don't dismiss it. But there are funds out there that for those who would be connected to healthcare in some way. So I will again entertain any conversation about that. We're being pushed more and more to collaborate, no different than Melvin and Kim just said, with the case management perspective, but also collaborate and coordinate with other funding sources so that your program is not, other than your match, is not exclusively funded through the continuum of care competition. Okay, so just throwing that out there, we have some opportunities. And again, this was just explaining, all of this came from the guidance, came straight out of the guidebook from last year. And again, it's new projects, but that at least one uses subsidies or subsidized housing units not funded through the COC or ESG. So if there's any comment, concern, question on that, it's going to be an interesting time to see if it comes back again this year in the competition, or if we have a little more leeway in how we show coordination and collaboration with healthcare. Okay. As we're moving right along, we're going to go over there's lots and lots and lots of things going on over the next couple of weeks. So we'll go over a couple of things. Miss Terry Edwards from Harris County Family Connections, you want to talk about, I've got you on the next couple of slides if you want to talk about it.
Yes, ma'am. Thank you for having me, guys. Okay, so
Sure.
this is the Diaper Day crawl, but it's a whole lot more than that. We will have other resource vendors going with us. It's like, you know, the caravan they had, the Silk Road caravan that they had back in the days.
Mhm.
So we'll have vendors going with us. We'll stop at each location. We'll be there for 30 minutes. We'll have music. We'll hand out all the resources we have, including diapers. I think we have DPH going with us. We have a married group, Family Connection. We have Vote Riders. So there's a lot of us going together. At each year, we'll stop and hand out resources. And we're trying basically to make sure we do most of the community in one day. And we're going to do more of these.
Okay. And the diapers are gonna go to whom?
The diapers will go to anyone that comes up and needs diapers.
Gotcha. So anybody that goes to any of these
Any of these,
providers would be, okay, gotcha.
they're beginning diapers. And the other providers will bring in resources too, whether it's resources to hand out or sometimes they
Sure.
have giveaways and prizes.
Question, is there a particular size that you guys see that you need more of than others in diapers if anybody's coming?
Oh, hey,
Um,
Miss Terry, I'm on.
Oh, our group is here. She can talk about it.
Hey,
Great afternoon. My name is Summer Lewis. I'm the Community Relations Representative for AmeriGroup, and we're super excited to host this event with Family Connections. Often in some of my smaller counties, there's a need, and that need isn't always addressed. So this diaper crawl is an awesome opportunity for us to go to each of their cities and provide. Generally, our diapers will provide newborns through size 6. I do have some pull-ups, but pull-ups is not part of our value-added benefits. So the reason that we're doing this is because with members with AmeriGroup, if they are getting their EPSDTs, which is their yearly exams on time, as well as their dentals at their 6-month checkups with their infants, they can receive a free pack of diapers. So this is one of our promotional items. And generally we do not do the pull-ups. However, if your child has a medical need, there can be a prescription that is given for that as well. But we'll be providing from newborn up until age 6. And I've got a couple of pull-ups for children as well. We'll be giving wipes. And one of the biggest things that we want to target during this time is the redetermination. So if you haven't heard, we are coming out of that pandemic, the medical health plan emergency. And because of that, there will be folks that will be losing their Medicaid. And so we want those members to know how to gain access or how to be updated. And so it's called Ready, Set, Renew. And we'll be giving that information out about Ready, Set, Renew. There's an awesome video that talks about what happens during the renewal process if your Medicaid is changed and you're determined ineligible. Ineligibility may be because your circumstances have changed. Maybe you've got a job that pays a little bit more money. And so therefore you aren't eligible for those Medicaid services, but there may be some other programs that you are eligible for. So that's one of our biggest drives for this diaper crawl, is to get out that redetermined information and help folks best understand how that they can be supported.
so if I could ask, is there a way that we can get some information so that as we're seeing clients, we can make sure we remind them of that? We can push this out to all of our other community providers and everything else to remind people, to remind them, to ask them again.
Very much so. We do have handouts that are either in the physical form, or we can also share with you some electronic forms.
That'd be great.
We are also having conversations with various providers where we may even set up a time that we do a Zoom similar to this, that we talk about the redetermination. So I'm open to all of those opportunities, as well as opportunities to connect with other partners to do events such as our diaper crawls or things that are focused. My main focus is on the babies, mamas that are babies, moms, and pregnant moms, as well as children. The unique thing about AmeriGroup is that we also house the population of youth who are in foster care. And what a unique conversation to have today, because many of our youth who have been former youth in foster care are also a part of that homeless population. And there are resources and support through AmeriGroup, which is their insurance provider, that they can be supported as well. So I would love to have the opportunity to share, and would love to even share that electronic document and see where we can go with having more conversation about this.
Perfect. Well, yes, if you will, Terry will make sure, I'm sure that you get the email address to share that electronically. We'll be glad to put it out in our bi-weekly newsletter and send it out to all the participants here and post it on our website as well.
Awesome. Thank you for this opportunity to let me speak about this amazing event in Harris County.
And your name again, please?
Summer, Sommer, Lewis, Lewis. So for
Okay.
those of you who had contact with Lauren Chambers, I guess I'm the new Lauren.
You're the new
Chambers.
Lauren, yeah.
Yes.
Someone put your information in the chat box so they can contact you.
Well, currently I'm on side the road, Ms. Terry, and
I'll send back your information, no problem.
I appreciate you. Thank you.
You're welcome.
All right, and then we have the Hispanic, the Spanish version of the diaper crawl flyer there. And
We
then,
do.
and then, yeah, we have it here on the screen. So, and then we have Valley Healthcare. Miss Terry, you want to talk about your relationship and what's going on there as well, and then we can move on.
Okay, so we're in Waverly Hall, which is kind of one of the depressed areas in Harris County. It's one of our pockets of poverty. I know nobody believes we have pockets of poverty, but we absolutely do. This is one of those areas, and there are no providers in this area at all. The closest provider is in Hamilton with Mercer and an acute care, but there's nothing around here. So seniors who don't want to travel far, they'll have the ability to come here. They can see an RN is going to be on board, and she'll also be doing telehealth with them. So you can see a doctor while you see a nurse, get all your shots done, and go back home. They're going to be doing this for as long as we need them. And they're also willing to go, if I need to go them to go to another area in the county, they'll do that as well. So we're like a traveling mobile health and wheels.
That's awesome. Awesome. All right. Thank you for sharing that, Terry.
You're welcome.
Next, we've got, oh, I'm sorry. We got boat riders. I thought you were done. See there, Terry's just too busy. She's trying to show off.
No, I'm not. Okay, so every third Wednesday, we kind of open the office to the community. We have Panera Bread for the community. That's through a program with Panera Bread. We have Valley Healthcare coming. We have a free voter ID clinic, which is a virtual clinic. We have laptops provided by Faircon, so that with free Wi-Fi, so that people can come in and they can talk to someone from free voter ID clinic. They can get the IDs done. We also have the ability for them to come in and do job applications, seniors that want to do benefit applications. So a lot is happening here. This is important in this community because there's really no resource right here. Unless you head to Columbus or you go, and again, nobody likes to travel. We have no public transportation. That would be nice, but we don't have one. So that's happening here as well.
Perfect. Thank you, Miss Terry.
You're welcome.
Any questions for Terry? Okay, and Keisha, I can't see if Keisha's on here. I didn't see her earlier. Keisha from Department of Behavioral Health sent out an email the other day saying that they're trying to get folks who have had experience with the co-responders, which is, if you remember, it's I'm not sure if it's a social worker or it's an LPC that goes out with police when there's a person who's in a mental health crisis to try and de-escalate the situation and take care of it from a mental health stabilization perspective rather than a law enforcement perspective. And Department of Behavioral Health is asking for folks who have had experience with the co-responders to please complete a survey. So I promised her I would put it out here. So here we are. If you've had any experience with the co-responder program, please complete the survey. And again, we'll be sending all of this out to everyone. Vote riders are here every first Thursday in the morning and third Thursday in the evenings here at Home for Good as well. And Goodwill has a whole bunch, and I'm not going to sit here and read it because I think there's like 6 or 7 slides. of all kinds of stuff going on, but everybody will have them all. Cinco de Mayo, job fairs. Again, there's lots and lots and lots of opportunities for folks to have access to employment services at Goodwill in the month of May. So all of those will be included. And their training academy as well. And then Liz sent out this morning that she's had some cancellations for her upcoming trauma training. So Liz, I threw literally the words from your email and your email address up on the screen here. I don't know if you want to address it. And then the link you put into the chat, I put at the bottom here, just so I wouldn't forget it. Did you want to talk about this at all?
Sure, just if you're interested in going, I encourage you to register right away. We're so excited to bring back this training from Georgia State University. It is awesome. It is titled Children, but it will help you understand the adults you work with very well. So it's great training. If you're interested and have problems, just shoot me an email and we'll make sure you get that registration done.
All right. Thank you, Liz.
Liz, how many slots do you have? I'm trying to see if I can get because my other coordinators in other counties, they're working on literacy and something to do with kids, so they would actually this would be beneficial to them. Do you have a lot of slots open?
I don't have a lot, but but have them go ahead. If the class gets full, it's more likely we'll be able to hold another one.
Okay, I'll send it out to them.
Great.
Thank you.
All right. Anybody else have any other updates, announcements, revelations, topics for discussion? Anything?
Hey, yeah, Pat, this is Tarika.
Hey, Tarika.
If anybody has any clients that needs to come to Vote Riders, if they can just let us know so we could plan accordingly for the nights that we have to stay after hours.
Okay.
You're good.
Again, if you have anybody who needs to get an ID, social security card, birth certificate, and for some reason can't come during the day, we do have that one evening a month that we have Vote Riders here. But we'd hate for the volunteers to sit here and nobody show up. So if you'll let us know, that way we can plan accordingly. Anybody else? Anything else before we call it a day? If you have not, please, please, please make sure you put your name and information into the chat box, name and organization into the chat box so that we can have a record of your attendance. Anything else? We got about 30 seconds and we're going to cut this off.
Yes,
For
Pat,
those-
this is Reverend Balton, if I may, please.
Yes, sir. How are you?
Yeah, I'm doing good. I'm with the Plummer Home with homeless veterans.
Uh-huh.
And we do have a fundraiser going on down uptown. To be on the 20th of May from 1 to 5. Got the Cajun Cousins and the Loco. They're sponsoring this. Got celebrity chefs that will be doing this. So
Okay.
it's going to be a great big fundraiser. So you know, if any of y'all want to come, please do that so you can help us fund and help donation for our homeless vets.
Okay. Would you be able to send us some information so we can send it out to the group as a whole?
Yes, I do
That'd be
have a
great.
flyer, so I
That'd
get
be
that.
great.
Okay.
That'd be perfect. We'll go ahead and make sure it's attached and so everybody will get it.
All right, thank you.
Great. Thanks. Anything else before we go, guys? All right, we're going to call it a day. Everybody have a wonderful afternoon. Give you a few minutes back. And we'll talk with you all soon and look forward to having further discussion and sending out some more information about performance and evaluation and how we look at that from a global perspective. See you all soon.
Thank you, Ms. Pat. Have a good one.
You too.
Thank you, Pat. Do you have a few minutes afterwards or?
Yeah, Terry, call me.
Okay, this is Jennifer. I'm gonna call you as well.
Uh-oh.
Uh-oh. Bye.
Hi.
Bye.